Hello, Dr. Kamal. So nice talking to you and to seeing you on our weekly Pure Bliss Akram chats. I wanted to also remind our fans that the previous conversations were about the energy levels and how Ayurveda can help you with that, and about diet for premenstrual syndromes. So there were some really good tips that Dr. Kamal shared with us, what to eat and what not to eat to have a wonderful 3 or 4 days. Okay, and today, Dr. Kamal, we are talking about your brain, depression, brain, diet, very difficult topics. So if someone have not heard you before, please tell us more about yourself.
Hello, everyone. I'm Dr. Kamal, and I'm an Ayurvedic practitioner. I have graduated from a very prestigious university and a government Ayurvedic college and hospital from Kurukshetra, India. And my post graduation was from Manipal University in Panchakarma. I also specialize in gynecological disorders and neurological disorders. So, with covering all these topics, we will be having a lot more videos to share with you. And after listening to them, you can just book an appointment with us at our website of Pure Bliss Akram, and we will try our best to guide you and to treat you.
Okay, thank you very much. So now the first question, what are the natural methods to detox your brain? And why would we even do the detox of the brain, right? Everybody thinks that brain is such a gray cells, white cells, such a fragile thing.
As because we always think about, detoxifying our body, like physical body, and nobody talks or think about detoxifying our brain. So there was a technique mentioned by the ancient Maharishi Patanjali, and that's called the Saucha or the cleansing. And nowadays we call it as detox or detoxification. So whenever we talk about Ayurveda, it is all about detoxification of your physical body. But today we will be talking about detoxifying your mind, and that is the one of the most important organs in our body.
Yes.
So I'll be starting with few points and guiding our viewers with how they can just detoxify their brain using few of the techniques. So first one, I'll be starting with the diet, as Ayurveda considers diet as one of the important thing to consider when you are suffering from any disease. So we should include some berries like strawberry, cranberry, blueberries, and blackberries. So, and if we consider like in India, there are other berries like bear, amla, Indian gooseberry, and falsa is there. So, because the compound that is present in these berries just cross the blood-brain barrier and reach the
Ah.
learning and the memory center in our brain, which help improve our brain and the mental health. So this is one of the very important thing which we take very lightly. Like we think mind is something which we inherit from our parents, which we have got from our parents, and it will be like this only the whole of our lives. So eating these things can help you improve with that.
So,
Second, yeah.
going back and putting everything in the in the Western context, for instance, if you have no access to the Indian gooseberry, you can also try. Maybe it's not as good, but it's also perfect. The regular gooseberry, the European gooseberry, right?
Yeah. That's why I mentioned both the berries, you're the Western ones and the Indian ones, because we have followers from all over the world. So we need to be, consider everyone with us. So
Sure.
the word berry is itself very important when it comes to the brain health. And I would like to mention the second thing, which is Carolina's favorite, that is ashwagandha. And so
And what the
ashwagandha,
ashwagandha? It's the smell. It means in Sanskrit the smell of the horse.
yes, ashwa means horse, you got it right. And the gandha is the smell.
Oh.
So ashwagandha smells like a horse because it is very bitter in taste. And but it is very good for your nervous system. It helps protect the brain damage. And also it can be taken with water or milk. The powder can be taken with water or milk. So it is one of the very important herb in Ayurveda for the brain health. And the third tip that I would like to tell you is chanting mantras. which is nowadays getting very trendy. And all of us who are suffering from stress, anxiety, depression just want to come out of that by any means. So, chanting mantras is a very ancient technique that has that healing properties. When we chant some mantras for a very long time, focusing on our breathe, because mind is something which is not in your control, but your breath is under your control. So
Yeah.
they both are very much related. When we focus on the breathe, we can control our mind too. And after that, one pranayama is there, that is Kapalabhati. That is a cleansing technique which cleans your mind, which cleans your lungs from the internal. So that's a very powerful technique that we should try. And other than that, I think there are a lot of things that we will be discussing about in our further questions. So as of now, I'll be just counting it on my tips. First one was berries, second was Ashwagandha, third was chanting mantras, and then was the pranayam Kapalabhati.
I
So
know
this,
from my own example that if you have fluctuating sugar levels, your nervous system usually really gets a hit. So a long time ago, when I went to India, the Indian practitioner, Ayurvedic practitioner, told me to take also Brahmi Ghrita, actually, so ghee, Brahmi in a ghee, and that actually wonderfully regenerates my brain. So
yes.
that's
So the
my
Brahmi
perspective.
comes under the category of Medhya Rasayanas, like the medicines that work on your brain and help to improve the mental health. So yes, you mentioned it right. The Brahmi is also one of the good examples.
Okay, so how often do we do the detox of the brain?
So it's a very good question actually. But nowadays the way we all are living, and
Mm,
especially after the COVID, when we have a lot of patients suffering from depression, anxiety, and panic attacks.
mm.
So, according to me, it is something which has to be practiced regularly. Whenever you get some time, it's not like you have to wait. Okay, when will I will be in depression? I'll just do these things. When I'll be having anxiety, I'll start doing these things. So just to rejuvenate, like we do our physical body through Panchakarma, even if we are healthy. So we should just do it on a regular basis. Make it a habit to have some routine before going to the bed. There is a reflection technique that we should use. Just analyze the whole day and then focus on it where you can improve. So I think what you are asking is how often we should do it. So it's on a regular basis will be a very good option. If not, then at least on weekends when we all are free. So it's like that.
So this is actually very good because we were taught the daily regime, the with Ayurveda, and the yes, the detox or liver detox twice a year for the spring
Yes.
and for the autumn. So now we have also taken recommendations on how to take care of your brain, and
Right.
this is also regular. So you are suggesting every day. Wow, or
Yes.
maybe on the weekends. Very good.
Because it's not such a big process that will take a lot of time, a lot of days. It's something that you can just inculcate in your daily routine, as you mentioned.
Exactly.
So
Yeah. Okay, so now you have very clean detox the brain, and you still have anxiety attack. How do you cope with the anxiety attack?
okay, so anxiety is an emotion. It's not
Mhm.
something we can just consider it as a big disease that we have to deal with, go to a physiotherapist, psychotherapist, and to discuss with this thing. We just need to understand how we can handle anxiety. We as humans have this quality of deciding what is wrong and what is not right. So this is something that we have, and in Ayurveda we call it as a viveka buddhi. And the human personality has two things, one is emotion and the other is intellect. So whenever the emotions are weak, our intellect have to be stronger. That's the time when we can just overcome our anxiety. And whenever we are suffering from some sort of anxiety, most of the times it is because of the results. We are just focusing on result, whatever we are doing it, what will happen if this will go wrong, what can I do after that? So I think this is all in our mind, it's all in our brain. We have to just choose. We can think good as well rather than thinking negative. So it's an emotion that has to be dealt very carefully, very patiently. And for these things, we have some meditative techniques in Ayurveda, in yoga, to overcome the anxiety. And if we talk about the medicines, the same medicines we discussed earlier.
So this is actually a very complex topic because we looked at the statistics of the suicide rates among young people and dissatisfaction, depression, and the anxiety may be also related to the use of the internet and the social media, right?
Yeah.
When you get every 30 seconds liking or disliking on your Instagram, then you are always hyper, right? As if you were in a stress. Your body produces adrenaline and your heart starts beating faster.
Yes, hormones, yes.
So very complex.
And it has to be, dealt, because when we don't deal with anxiety, they just got converted into panic attacks, which is also a very uh, good term used nowadays, because panic attacks can be in the form of anything, like heart attack, which is very common. Any muscular spasm can be there. You're not able to breathe properly. So muscular tension is there. So I think it can be, modified in such ways that we should not lead to a point where anxiety is converted into panic attacks.
Yeah,
So it's a very important thing to discuss with whomsoever you feel comfortable, but don't just ignore it.
yeah. So, from our experiences, at least in the West, when we get our patients, they usually went through all the possible allopathic choices. They went through massages, physiotherapy, and then they come to us. They perhaps they are taking Prozac or any other antidepressant. Maybe they also smoke marijuana, and they are just totally exhausted. And they think, okay, well, I've exhausted all of my possibilities. Maybe as a last hope, Ayurveda can help. What can we
Yes.
do for such people?
Yes, you said it very right, because I have seen a lot of patients coming with this, this much big bundle of reports and all the records that they have visited all the doctors around the universe, and then they remind you, okay, yes, we do have an option of going to an Ayurvedic doctor as well. So yeah,
Yeah.
that's a funny thing as well. But what I have observed is people are nowadays so much habitual of taking these antidepressants, because it's a very quick way to get out of that. They get very good sleep with that. But in the longer run, it's not a good option at all. But whenever you are taking antidepressants already before coming to us, it's not like we should just stop it all of a sudden. We should just have a slow cessation of the doses of antidepressants, because when you suddenly stop the antidepressants, there is a massive havoc in your mind that
Mhm.
goes on, and you cannot just control it. So the first thing is, like, you should always consult your doctor and try to reduce the doses slowly.
Mhm.
Along with that, we will be having some Ayurvedic medicines, herbal medicines, some techniques to deal with it, like Panchakarma techniques. We have this Shirodhara and all these things. And just go out, socialize yourself, talk to it to somebody, because the depressed person is like, feel like sitting in a corner and doing nothing. That's not the solution at all.
Yeah.
So to avoid these antidepressants, you have to start with some Ayurvedic diet and lifestyle changes, some medicines along with some Panchakarma and Pranayama techniques. So with that, we can just ultimately cut out the antidepressants and be on natural things to cope with the depression.
Exactly, that's what you said very eloquently. It's not only your mind. If you are suffering from a strong depression, you probably have also problems digesting because there's your digestion, your bowel, it's like the second brain, right? So
Yes,
you also have other problems with your health. It cannot be only your mind because your
yes.
mind affects many different hormonal functioning and enzymes and other stuff. Yes.
It's just the controlling, part of the body, but it is affecting every other part of the body as well. All the signals are just coming from here, and the whole body is governing according to that. So
Yeah.
everything is just interrelated.
Yeah. Difficult topics. Okay. I know that you have also worked with autistic kids, right, in a clinic. Can you tell us a little bit more how what Ayurveda can do for this group of people?
Yes. I was just relating it to the thing that you said, because you said your mind is also related to your gut. That's the second brain, and this is the basic, base for the autistic child. What is autism actually? This is a neurodegenerative disease which can be because of a lot of factors. It's not always congenital that the baby is getting from birth. It can be because of the stress that the mother took during the pregnancy. It can be due to the faulty lifestyle and the diet that mother has taken during her pregnancy, because that time whatever she is doing is affecting the baby. We all know that. So
Yeah.
these are the factors which we don't know much about, that mother's condition can also affect the child getting autism. So what Ayurveda considers is that there is a triangle called Om triangle, that is AOM. A stands for the Agni, the digestion power,
Mhm.
and the O stands for the Ojas, that we have discussed in the previous video. You told us about that. So that's the main thing in our body, our internal environment. And third one is the M, that is mind. So
Mm.
whenever there is a mismatch between all these things, the Agni and the mind and the physical body, the child suffering from autism is not able to, connect with the external environment. There is problem in communication with the social people. He's no interaction is there. He just have that repetitive things, doing that things, and trying not to go into public places, just be in himself. So these are the things that we can link if the child is autistic or not. So first I told you Agni. We can just get to know about the Agni through his digestion. We can ask the parents about his digestion. Second is Ojas. So there are few symptoms of less Ojas or low Ojas. Uh, children will be having the fatigue, weakness all over the body, depression, and low moods, self-injurious practices. So these are the signs of low Ojas.
Wow. So actually,
And
Ayurveda has some real, palpable, touchable solutions for autistic kids because in the West, in the case of allopathic medicine, very often you say, well, it's really hopeless. You can have a little bit of improvement, or if you stay on the same level, then it's okay, right? But Ayurveda actually is working with those kids.
and
Have
I
you,
would like,
from your, sorry, Dr. Kamal, from your perspective, have you seen any patients that actually improved using Ayurveda or going through the Ayurvedic protocol?
yeah, of course, I would like to share a very interesting story that I have managed myself uh, in a very good institute in India, and I got really tremendous results. And I was just studying that whole case. So there was a patient of 12 years of age, male patient, and he was diagnosed as an autistic child at the age of 4 years. Because most of the times it is like you can just diagnose at 2 to 3 years, but as early as 18 months also we can diagnose a children with autism. So he came to my OPD with the symptoms of not eating properly, less appetite, the problem of constipation. Along with that, he had some repetitive movements. Like whenever he used to come to my OPD, he'll just keep on picking things from my table,
Mm.
throwing it away, or just take it with himself. So these are the behaviors that I observed in him. Secondly, what his parents told me was that he has problem with sleep. He'll just wake up in the middle of the night and feel like
Wow.
going outside. He don't like to interact much with the people outside. He don't even told me his problems. Everything was told by his parents.
Mm.
So that way they are not much into interacting with the other people. So these were the few symptoms, and some of the like development was also hampered. His motor development and the sensory development was also impaired. So based on all these things, he was diagnosed as a autistic child. And what I did was I started with a very good counseling with the patient and his parents. Then we started some of the herbal medicines along with that. I made some changes in his diet and the lifestyle to make his Agni better, to make his digestion power better. Third, I have added some of the Panchakarma techniques like Basti, like enema that we call it enema, some Nasya techniques, putting oil to the nose, Shirodhara and Abhyanga, like full body massage with some good oils that help with his development of the bones and the muscles all over the body. So like this, it was a treatment because of course it is a problem he's suffering since his childhood. So of course it will take at least that much of time to get cured, and it took me around 6 months to have very good results. But he got good results in the terms of his digestion was improved, his constipation was gone completely. He has that better interaction with me. I can observe it. Like the first day, the way he was talking to me, and the last day of his treatment. So in this way, I have just observed so many results along with that, because it's not about the child who has to deal with it. The parents also has to get involved
Yeah.
completely if they want their child to get cured.
So actually, this is a beautiful story. Thank you for sharing, Dr. Kamal. So this is one of the reasons why we went into the field of Ayurveda, right?
Yes.
To see real changes, real improvements. Wonderful. Thank you.
And just to see that happiness on the face of patient as well as the parents, because
Yeah.
he's at such a age in his life where he cannot just give up. There is a
Yeah.
lot more to do in his life. So that's was such a great achievement for me as well.
Mm.
And I'm also working on a few more cases like that. Hopefully we'll be getting good results. But I would like to add one more point. Age is very important factor, because when a patient comes to us at an age of 16, 17, it's very difficult to go back and cure him properly. The early the patient will come, the more chances are there to get him cured. So yes, age is a very important factor.
So would you say that by 6, 7 years, this is like
Max,
the
yes.
ideal age? Okay.
Because in this case, as I told you, I was able to get good results in few of the areas, but not 100%. But
Sure.
that was also a good achievement, because parents were just given up. They have no hope that their child will get improved or something like that.
This is exactly what I'm talking about. Being Ayurvedic doctor or Ayurvedic consultant, it's like being a little of a magician, because we always get that we are the last hope. When everything
And
is
just
exhausted, they come to us.
yes.
Yes.
And it is so good to fulfill their last hope, so that they'll feel satisfied that yes, they have gained something from Ayurveda as well.
So our talks are usually for people who are in real need of help, but also for everyone as a preventive measure, because we know that Ayurveda is really into prevention as well as healing. So repeating one more time, if someone wants to have a healthy mental life, good detoxed brain, and a lot of energy to live and wonderful sleep, they should follow good diet, as you said, right? And sleep regularly, the regime of the daily and the seasonal changes. And what else?
So I think along with this, you have to make some changes in your daily routine. That will be the most important one for the persons who are already healthy but have to be like maintain it. Because nowadays, what I am observing is people are not that much into going to a doctor, consult, and take some medicines. So they want some easy tricks to do it at home and get relieved. So you can just start with your own daily routine only.
So
And I will focus
yeah,
on
sorry.
pranayama. Yeah.
So if we have, we sometimes we get this wonderful patients who just come to us and say, "Okay, I just want one pill." What
Yes.
would you tell them?
So I have mentioned that ashwagandha and the Brahmi you told me. So these are the two things. Other than that, there are other of forms of medicines as well. Whatever the patient is comfortable, we can just give it in tablet form or a powder form. There is a herb called ashwagandha is there, Brahmi is there, Mandukaparni is there, and Shankhapushpi is there. And the other one is tagar, which is very good in the case of insomnia, patients suffering from inappropriate sleep. So these are the few herbs, but I will not mention more of them because people sometimes start taking it on their own. That is not good. You
Sure.
should just consult some good Ayurvedic doctor and just then start it. That will be a better idea.
And what are the worst things you can do to your brain?
I think the worst thing that we can do to our brain is torturing it just by overthinking,
Uh,
collecting the thoughts in the mind, not discussing it. Because I think, as the saying goes, it is the human mind. If we channelize it, it can just take it to your best state. And if we do not channelize it, it will take you to the worst state as well. Where comes the chances of people doing suicidal attacks, getting into depression, giving up on their lives? So I think this is something that need to be discussed, need to be come out of your brain. Don't just make a havoc into your brain and make it a dustbin, throwing all the negative thoughts. Try to take it out, boost it out, and talk to somebody about it. So I think that's the main thing we should all understand.
sure, very well.
Overthinking, that's
Yes, very
very
well
bad.
put. Yeah. Okay, thank you. Always fascinating talking to you, Dr. Kamal. Thank you.
Thank
And
you.
let's invite everyone for the next week.
Yes,
Okay.
we'll be coming back with a new topic.
Yes, I think we are going to talk. This is top secret about
Yeah.
ketogenetic diets and
Yeah.
paleo diets also, and how they affect you. And really, I think Dr. Siddhartha is going to answer those questions.
Yes. He is coming over for the next week. Yeah.
Okay.
Okay.
Namaste.
Thank you.
Thank you.